Are you thinking it's time to drop that bottle or wondering why we make such a big deal of it as pediatricians? Today's episode is all about the how and why you do it.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. Today, I want to talk about a really important topic that we are always talking to our patients about at the 12-month visit, and that is dropping the bottle. So transitioning from the bottle to a cup. Hopefully at this point, you have been practicing with an open mouth cup since the 6-month visit. You can refer to our episode on how to do that if you would like. So hopefully your child has had some practice with this. If not, that's okay. Let's talk all about why we do it first, because the why will really help motivate you to do it, and then we'll talk about the how. So the first reason that we want to transition your baby off a bottle at the 12-month visit has to do with dental health. So the suckling motion that we use from drinking from a bottle or sippy cup is very different than the motion we use from drinking from an open mouth cup. And prolonged suckling can really inappropriately strengthen muscles in your face and also cause misalignment of your teeth and hard palate, which can lead to issues later on, not only for your dental health, but also with articulation and sleep. 2, prolonged bottle and pacifier use has been associated with increased ear infections. And so that actually has to do more with when your baby is getting a bottle or pacifier. So specifically laying down, like if you're letting your baby have a bottle prior to naps or bedtime, or the pacifier at those times, fluid tends to pool backwards, and it can cause middle ear infections, which lead to more antibiotic exposure, which we're always trying to avoid in our little ones. Along the same lines, if you're allowing your baby to have a bottle when they are laying down to sleep, either for bedtime or naps, that milk or formula or breast milk on their teeth can actually predispose them for dental decay. So but most babies cannot drink from an open mouth cup when they're laying down. So this helps mitigate some of that risk because it's not really even an option for them. Another reason to transition away from the bottle is your baby is now at a developmental age where we should be encouraging other forms of self-soothing outside of suckling in the bottle. And so prolonged dependency on that can get in their way from them learning age-appropriate developmental skills, which involve controlling and regulating their emotions in the absence of an associated device such as a bottle or a pacifier. Same thing with sleep. Bottles and pacifiers can have big time sleep associations at this age, and we really want to encourage them to use developmentally appropriate alternative methods to soothe themselves and to get themselves to sleep. Now we talked about why to do it. Let's talk about the how of doing this. So there's many, many different ways to do this, and there's no one evidence-based method. So I don't mean that there's been research to prove that one is better than the other, but I'll just share my thoughts with you about why I recommend it the way that I do. So usually I've encouraged parents starting at the 6-month visit to use an open mouth cup so that they know that their child is capable of using an open mouth cup when it comes time to get rid of that bottle. If your child has not been using an open mouth cup, I still encourage you at the 12-month visit to go home and really just get rid of all of those bottles, put them away. A neurotypical 12-month-old is developmentally capable of using an open mouth cup. So even if they haven't had that practice with it, they are capable of doing it. And I find that if you do a more gradual transition, so just dropping a bottle every day, it just prolongs the transition from the bottle to an open mouth cup. And if you're dealing with a toddler you're already struggling with a little bit of some power struggles between you and your toddler, it just increases the amount of time where you're having that power struggle with them. So I really encourage parents at the 12-month visit to just go home and put the bottles away and make an abrupt transition from the bottle to an open mouth cup. You absolutely can do this in a more gradual manner. So you could either replace one bottle at a time with an open mouth cup, or you could go to an intermediary device. And if you're going to do that, my preferred intermediary device would be a cup with a straw, not a sippy cup. But my preference is you go straight from a bottle to an open mouth cup abruptly. So some fun tips to make this better for you and your child and be more fun, and 3, hopefully more successful. So my first tip is make it fun. Choose a really fun cup get some stickers, let them decorate their cup. If you can get a cup that they can decorate, involve them in the process of picking out the cup. So maybe you're going to take a trip to the store together. Tell them we're going to take a trip to the store. We're going to pick out your big boy or big girl cup. Let them decorate it if they want. And then I would encourage you to go along with that big boy and big girl cup to pick big boy and big girl drinks in their big boy and big girl cup. So try to avoid putting formula and breast milk in their big boy cup or big girl cup. And if they're greater than 12 months old, definitely not formula, but cow's milk in the big boy, big girl cup. So what should be going in there is really just ideally water, but if not water, full fat cow's milk or a cow dairy alternative. But my preference is that it's always just water. One, to get your child used to the taste of water and to associate water with being something that we normally drink with meals and snacks. And two, again, so they kind of get that the big boy and big girl drink goes in the big boy and big girl cup. So second pro tip, be consistent. Once you've made the transition to the big boy and big girl cup, do not bring back out the bottle. Consistently offer them the cup with every meal and every snack. So that's 3 meals a day, and depending on your child's age, 2 snacks a day. So they know when they're sitting down for their drink, that's when it's time to have their meal, and vice versa. You really want to discourage grazing behaviors, both with snacks, but also from their big boy and big girl cups. So we don't want to be offering them small amounts of milk all throughout the day in their big boy or big girl cup, because one, it interferes with their normal appetite because milk is quite filling. And two, it can set up for more picky or selective eating. So try to offer them their cup with their meals and snacks. If they do not drink anything from their cup or snack, even if it's been a whole day, as long as they're making adequate urine, that's okay. There's tons of water in food and fruits. And so they're still getting hydrated through their actual food. And when they get thirsty enough, they will drink from it. So try to be patient with yourself as a parent and be patient and gracious with your child. And as long as they're making good urine, you can reassure yourself that they are getting hydrated, even if they skip their cup at snacks and meals. Another pro tip is to offer them tons of encouragement and praise during this time, especially if your child has been using their bottle as either a sleep association or a comfort measure. Those children sometimes need extra grace and extra comforting during the time. Don't be afraid to offer them more comfort and more positive reinforcement in place of giving them back their bottle as the transitionary comfort object. So don't be scared to hug them, to let them know that it's okay, and to give them tons and tons of positive praise when they do finally use their open mouth cup. Lastly, you do want to focus a little bit on nutrition during any transitional time. So when your child is transitioning from the bottle to the open mouth cup, if they've been previously getting formula in their bottle or cow's milk in their bottle, if they're over 1, really what they are getting from the cow's milk is fats, vitamin D and calcium. And you can just make sure that you're offering them a well-balanced meal and snack throughout the day in place of that. And so even if they're not drinking their cow's milk from their open mouth cup, as long as they're getting a balanced meal on their plate, that's okay. Again, try to remind yourself every child is different. So just be prepared, be patient, and be consistent with both yourself and your child during this time. I hope you found this episode overall to be helpful. If you have any questions or concerns, or you're a fellow parent out there and you have some other good pro tips for the community, please leave them below.
Thank you for watching the Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.